Hi everyone, this is Faith. I'm going to make a little short video because I'm constantly asked this question, should I get a sleep trainer? Should I do some sleep training to make my baby sleep more at night? And so I'm going to be very direct about my answer with that. And this comes from 20 years of experience. I'm a board certified lactation consultant, a family nurse practitioner, and I was a nanny for several families with twins, triplets, and single babies. And I hear the complaints and the results all the time from things people try. So I feel like this kind of trend of getting a sleep trainer preys into this idea, this cultural idea that babies can sleep at night and that you can train them into sleeping at night. And if you're not training them, it's because you're doing bad habits. I feel like the idea that an infant is supposed to sleep at night is the same as the idea that 4 weeks after you give birth, you're supposed to fit in a bikini, or that your baby should potty train when they're 6 months old. Developmentally, babies cannot do that. And likewise, when it comes to eating, babies who are under a year old, they're not eating steak and potatoes. They're just having only mother's milk. They might be having a few solid foods here and there because they're learning to eat, but they're not getting enough calories to help them get through the night. And they're growing so rapidly. We're adults, we're not growing, so we don't have that like crazy drive to wake up in the middle of the night because our blood sugar is just crashing. So for this little baby, they wake up at night, not because they're trying to screw with you, not because they're bad babies, not because they have a behavior problem or a problem soothing. They only wake up for a single solitary reason. Their blood sugar drops, their brain needs sugar because it's growing so fast, and they wake up and they ask for some calories. And I'm going to tell you the truth because they have done a lot of research on this. There's tons of research on infant sleep. The research that's been done has shown that you can train children not to cry overnight, and I'll talk about that in a second. But infants, they will still wake up no matter what to eat overnight because if their blood sugar drops, they'll wake up. But some babies have been trained just to lay there by themselves in the dark and not cry to conserve energy because they know no one's going to come. So let's talk about sleep trainers. And this is, I'm generalizing, so some people might hate me for these comments, but here goes nothing. I'm just going to tell you the truth. Sleep trainers are usually women who they may have not had any kids, or they may have had kids, but they're not women who had a low milk supply. They're women who had lots and lots and lots of milk and never had to worry about it. And so for them to go long stretches without making milk overnight, they're very lucky. Kind of the same amount of women who can fit into a bikini 1 month after they had a baby and look like a movie star. So most women, if they do not feed a baby overnight and their baby sleeps through the night, which, more than, 5, 6, 7, 8 hours, they will develop lumps in their breasts and get a wicked infection. If that doesn't happen and they're lucky, their milk will dry up. So the first thing you need to ask yourself is, all these people who are bragging about making, these great gains with infant sleep, ask yourself if they're actually breastfeeding, because they might not be breastfeeding mothers. And so if you're not breastfeeding, you're not worried about your milk supply. The next thing about sleep training is what they do, okay? You don't have to spend an arm and a leg on a sleep trainer, which what they do is they'll either have you download courses or make you spend an arm and a leg to come to your house. And let me tell you what they teach you. You can save your money. I'm just gonna tell you now what they teach you. Either A, they teach you to ignore your baby and let them cry. And if they say they're being gentle, they just do it over the course of 3 nights instead of 1 night. And they say, oh, it's like they're gonna slowly get your baby used to self-soothing. And if you pay a lot of money, they'll come to your house and you get to leave, and then they'll listen to your baby cry. And there's a reason why they need to do that. It's because for normal parents, if your baby's crying for a long stretch, it's like a knife in your heart. And that's for a very good reason, because you're supposed to respond when your baby cries. So they'll come to your house and they'll do this. And then here's what actually happens to your baby. Over time, they'll actually stop crying. And so let me explain psychologically why that happens. There's something called, in psychology, if you look up there, it's called an extinction burst. And basically when we do changes, it takes 2 to 5 sessions of change for humans to accept change if they're change resistant. And so basically what'll happen is 2 to 5 nights, your baby will cry for a very, very, very long time if they don't get food and they need it. And then after about 5 nights, they will give up and they won't cry anymore. It's also called learned helplessness. And so, like I said, their low blood sugar will wake them up, and they'll still wake up. It's just that they won't ask for food anymore because they've learned that no one's coming. And it does, if you do research on psychology, you will learn that it doesn't affect their anxiety and depression levels as adults when they learn that no one's coming to help them. And also it leads to weight loss. And also if it doesn't lead to weight loss, it does usually lead to early weaning. There are exceptions to this, but in my experience, when mothers brag that their babies are sleeping through the night, they are either lying or they're not breastfeeding. So I'll make some more videos, but this is a start. If you're trying to get a hold of me, you can reach out to me on milkmechanics.com.